Welcome back. This is part 2 of the Bone Clinic for Anatomy and Physiology 1, Dr. Nelson's class. So we're going to start here with the scapula. This is the scapula, commonly called the shoulder blade. And the scapula has a few structures on it that you need to know. So the first of which is the acromion process. So this large piece right here, this is the acromion process on the scapula. Okay, then the coracoid process is the smaller one here in the front, and then the glenoid cavity is right here. This is where the head of the humerus would articulate. So once again, this bone is the scapula. The small process here is the coracoid process. The large process here on the back is the acromion process, and where the head of the humerus would fit is the glenoid cavity. Okay, this easy way to identify a left from a right scapula is to simply look at the curve on it and where the acromion process sits. The acromion process sits posterior. So if you're looking at this particular scapula, you can tell that it is a right scapula because this curve curves in towards the spine. The humerus would be over here, so the arm would be over here, and the acromion process sits posterior. So this is a right scapula. Okay, next up we come to the humerus. This is the humerus. Okay. An important note on long bones such as the humerus and the femur. This rounded portion here at the top is called the head, and the heads of long bones always lean to the medial side. This is a handy piece of information to know when you're identifying structures on these bones. So the whole bone here, this is the humerus. Rounded knob here at the top, this is the head of the humerus. Okay, and then if we look down here towards the bottom of the bone, we have a few structures that we need to know as well. The first of which is the medial epicondyle. I'm going to take this sticker off of it. The medial epicondyle is this right here, this part that sticks out. And if you were to look at your own arm, hold it out like this knot right here on the side, that's where your medial epicondyle of your humerus is. Kind of sticks out on the inside of your elbow. So medial epicondyle. And if we look, notice the head leans medial, and this structure right up here is the medial epicondyle. Okay, the next structure on the humerus that we need to know is the trochlea. The trochlea is this indentation, this groove right here on the humerus. I'm going to turn it this way as well. It's this groove right here on the humerus, the trochlea, and this is where the ulna would fit together with the humerus, the trochlea. Okay, and then the last structure that we need to know on the humerus is this rounded portion right here. This is the capitulum, and the capitulum articulates with the rounded head of the radius, like so. So one more time, the whole bone is the humerus. This big rounded portion at the top is the head. This part that sticks out here, this is the medial epicondyle. This groove right here in the center is the trochlea. Okay, and then this part right here, this smooth little rounded knob, is the capitulum. Okay, and then we get to the bones of the lower arm, the radius and the ulna. This is the radius. It's found on the thumb side of the lower arm, radius, and you'll notice that the head of the radius is perfectly rounded like a nail head, so it's pretty easily identifiable. This is the radius, thumb side, lower arm. Okay, and then you have the ulna. This is the ulna. It's found on the pinky side in the lower arm. The ulna is pretty easily identifiable as well because it has this very distinctive U or cup shape here, and the ulna. Pinky side, lower arm. So, side by side, this is the radius with the perfectly round head, found on the thumb side, and then the ulna with its distinctive U shape here, found on the pinky side and the lower arm. Radius and ulna. Radius here and ulna here. Alright. So now we move on to the lower extremities. The lower extremities, first thing that we need to know is about the pelvis and the pelvic girdle. So making up the pelvic girdle, we have two of these bones. This is an os coxa, and then the sacrum and the coccyx would also fit together with two os coxa to make the pelvic girdle. I apologize, I don't have a completed pelvic girdle with me to show you it all together, but it's pretty easy to see in any picture of a skeleton. You have the two os coxa, and then the sacrum and the coccyx fit together to form the pelvic girdle. The os coxa itself is made up of three fused bones, and they are the ilium, the ischium, and the pubis. An easy way to remember these three bones are you put your hands on your ilium, you sit on your ischium, and you never talk about your pubis. So again, at the top, here's the ilium. This would be the hip bone. Okay? The ischium and the pubis. Few structures on the os coxa that you need to know. First of all is the acetabulum. The acetabulum is this big crater right here. This is where the head of the femur fits to make the hip joint. So this is the acetabulum. Okay? Then the ischial tuberosity. A tuberosity is nothing more than a rough or a bumpy part of the bone. So, don't know if you can see it very well on this video, but you see this kind of bumpy appearance down here on the ischium? This is the ischial tuberosity. That just rough, bumpy part down there. Okay? Then you have this big hole right here. This is the obturator foramen. It lets some blood vessels and nerves and whatnot pass through to get to the organs, male and female reproductive organs, and the bladder and things like that that are contained down inside the pelvic girdle. Okay? And then it also says on your list that you need to be able to identify male from female. One easy way to do that is to, when you have a completed pelvic girdle, is to look at the angle of the pubic arch. Okay? If we had another os coxa here on the other side, you would look at the angle between the two pubis bones. A wider pubic arch indicates a female pelvis, and a smaller pubic arch would indicate a male pelvis. I can't tell you as far as just one os coxa whether it's male or female. You would need the full pelvic girdle in order to tell that. So then we come to the largest bone in the body, and that is this. It's the femur. Femur is very large, very massive, very heavy bone. It's found in the thigh, and the femur has many structures on it that you will need to familiarize yourself with. The first of which is the fovea capitis. The fovea capitis is found right here on the head of the femur. That's this indentation in the head of the femur right here, the fovea capitis. Okay? This large rounded knob is the femoral head. Okay? And then this area right here is the femoral neck. Okay. Then you have the greater and lesser trochanter. The greater trochanter is this large, knobby looking thing here, opposite the head. This is the greater trochanter. And then this small little knob down here, this is the lesser trochanter. The linea aspera, you can see it pretty good here in this video. See this ridge right here that runs right down the posterior aspect of the femur? Right here. This is the linea aspera. Linea means line and aspera means raised. So this raised ridge right here down the center of the posterior surface of the femur is the linea aspera. Okay? And then you have epicondyles and condyles. The epicondyles are found on the front of the femur, or the anterior surface of the femur. They're here at the bottom, right here and right here. Now remember what I told you about the heads of long bones. They lean medial. So here's the head leaning medial. So here is my medial epicondyle, and here is my lateral epicondyle. Just like we have an epidermis on top of our dermis, we have epicondyles on top of the condyles. So again, medial epicondyle, lateral epicondyle. And then if I turn the femur over and look posterior, we have these two rounded looking knobs here. Okay, the one on the same side as the femoral head is the medial condyle, and the one on the opposite side is the lateral condyle. So one more time, this whole bone is the femur. Rounded knob up here at the top is the head. This little indention here in the head is the fovea capitis. Then we have the femoral neck, the greater trochanter, the lesser trochanter, the linea aspera, the medial condyle and the lateral condyle, and then the medial epicondyle and the lateral epicondyle on the femur. Okay, next up is a very easily identifiable bone. This is the patella, commonly called the kneecap. It's very kind of rounded, pretty flat, looks like just a little rock. This is the patella. Okay, then we come to the next two bones in the lower leg, the tibia and the fibula. These are the only two bones that spelling becomes important on your practical. This is the tibia, T-I-B-I-A, tibia. It's not a tibula, and it's not just a tib, it's the tibia. The tibia is the large bone in the lower leg, okay, and it has two structures on it. The first of which is the tibial tuberosity. That's this little bump right here at the top of the tibia. Okay, and then the medial malleolus is found down here. That's this little projection that hangs off, kind of sticks out. On your leg, if you look, on the inside of your ankle, you have that little knot. That little knot is made by your medial malleolus from your tibia. Okay, this is the tibia. It sort of resembles a golf tee, very flat here on the top. Tibia, T-I-B-I-A. It's two structures, tibial tuberosity and the medial malleolus on the tibia. Spelling counts on this particular bone. Okay. And then we have the fibula. Fibula, F-I-B-U-L-A. Fibula. It's not a fibia, it's a fibula. It's not just a fib. You have to spell this bone correctly as well, or it is wrong. F-I-B-U-L-A. Fibula. And the fibula has one structure on it that you need to be familiar with. That's found right down here. This is the lateral malleolus. That's the knot on the outside of your ankle. Fibula, lateral malleolus. Okay, that concludes the bones of the arms and the legs. The last video will cover the hands and the feet. All right, thank you.